But it turns out those temperatures may actually be a dieter's dream.
This is sort of the next generation of a technology that is probably going to supersede liposuction.
For those who don't want to have an operation, there's a new non-invasive option.
It sounds like science fiction, but it's now a reality. A revolutionary non-invasive procedure that's giving liposuction a run for its money by literally freezing away your fat.
The newly approved procedure is called Coolsculpting, and it promises to get rid of about 20% of fat wherever you aim it.
You know, you really, no matter how much diet and exercise, our hormones change, your metabolism slows, you're really not able to lose those pockets of fat like you were earlier in life.
If you tried every exercise and ab routine, but you're still bothered by the pooch or love handles like some people affectionately call it, listen up, because Dr. Orton is in our procedure room with a fat fix that everyone's been waiting for.
Coolsculpting by Zeltiq is a new FDA-cleared non-invasive procedure that uses advanced cooling technology to gently and effectively target and eliminate pockets of fat that are resistant to diet and exercise.
This is the machine right here. What the doctor does is he takes this part of the device and sticks it onto your love handle. The fat gets sucked into there and is basically frozen.
The science is called cryolipolysis, killing fat cells with cold.
The inspiration for this cutting-edge technology? A research paper from the New England Journal of Medicine written 40 years ago that showed how children who habitually sucked on popsicles developed dimples. The reason? Exposure to constant cold caused loss of fat tissue in their cheeks, a syndrome the researchers called popsicle paniculitis. 40 years later, doctors applied this research to the battle of the bulge, using intense cold to cause fat cells to self-destruct and become reabsorbed into the body.
At 63, Nick runs Revere Beach, skis, even tackles spin class. But like so many of us,
I'd like to get rid of that little fat area, you know, on the sides. I eat right and I do everything, but again, can't get rid of it.
So he turned to his dermatologist and a body-shaping treatment called Zeltiq, invented right at Mass General Hospital. 12 weeks later, we caught up with Nick. How'd it work? You judge. This is his love handle before Zeltiq and after.
If you actually look at a panis of fat, let's say around the belly, you grab it with this device. And when you do that, you actually are able to pull the skin up and then expose it to a lot of cold. I mean, real cold stuff. And when you get into that cold area, when you freeze the fat, because the fat preferentially gets cold before the skin does, you actually will turn on systems that kill those fat cells. When they commit suicide and die off, then your immune system comes over it, and the immune cells grab these cells that are dead, the fat cells, and takes them away. Now, you still have some fat cells left there, but over time, you'll shrink the total amount of fat that you have, and thus see the shrinkage that we're talking about.
Coolsculpting by Zeltiq has been featured extensively on daytime television, broadcast and print news, consumer and trade publications, and online media outlets. Some of the most influential and recognizable names in health news and entertainment have shared their fascination and respect for this safe and effective, non-invasive body sculpting procedure.
Well, there's a brand new way to put the skinny back in your jeans without dieting or downtime from surgery. Some might call it a cool way to look hot.
This is for people who are almost at their ideal body weight or who may want to jumpstart fine-tuning a certain area. It's body sculpting.
Coolsculpting by Zeltiq has been approved by the FDA. Dr. Fardad Varuzenpour uses it in his Beverly Hills office.
There's no recovery time. There's no pain, there's no anesthesia, there's no cutting, minimal downtime. You can do it today, back to work the same afternoon, if not the next day.
It's not going to make someone who's obese not obese. The idea is there are certain areas that really don't respond well to exercise.
All right, so I know this is going to take a few months for us to see the benefits, so we actually got some pictures for you, because I was curious to see what this might look like. So here's an expectation, anyway. Okay. You can just look up there, you'll be able to see it. So you see that you've got a before and after image, and I must say, I was flabbergasted by this. These are big changes. There's no surgical incision because there's no cut. And here's another example of a before and after. I mean, it's, you know, a couple critical inches that are hard to get rid of for a lot of folks.
I'm very happy, very happy. It's only been a few weeks since the treatment, but I can already see a big difference My pants are really loose.
Jan's measurements are taken, and they find that in just 4 weeks, she's down 1.25 inches, and she'll go down even more in the next few weeks.
And it sounds like it's a completely natural process once the fat's been treated.
Exactly, exactly.
This sounds like a win.
I know, it is. It is a win-win.
Almost all of us have an area or areas that poke out a little more than we'd like. How many of you have like a little area that you wish you could just kind of, yeah, okay. Well, all right. Yeah, everybody except for the 5-year-old who's sitting up there. Okay, you know, we're talking about the back fat, the muffin top, the love handles. There's no exercise or diet that targets specific pockets of fat, and many people don't want the downtime of surgery. No problem, because you can now literally freeze it away. It's a relatively new way of addressing fat, and here to show us how it works, why it works, and who it works for, please welcome from the Institute of Anti-Aging, Dr. Richard Leconey and Dana Leconey, along with their patient, Samantha Hall. Hi. Okay, let's start with Samantha. You're one of those people that deals with what a lot of people deal with.
Yes.
You look like you're relatively fit, petite little turbo body, except there's that little area of the stomach.
Yes.
That no matter how much exercise or diet you do, can we see what we're talking about here? Yeah, yeah, let's see. Okay, so there you go. You got the rest of your body is like a hard body, and then that part right there. And Dr. Leconey, that's the problem that a lot of us deal with. If you are lucky enough to have basically most of the fat gone, it's just those flabby areas where the fat centers.
Right, absolutely. This is a technique that is really designed for the people that are fighting the good fight and making a reasonably, proximity of winning. They're within 10–20% of their ideal body weight. But they have these little areas that are just what you call exercise and diet resistant.
Yeah, they need some sculpting.
No matter what you do, they just stay there. And so it's usually a smaller area that can be targeted by a technique like this. This is revolutionary. This is the first time a cold technique has ever been applied to fat reduction in a permanent way.
Yeah, and that's what the goal is to do less trauma to the body if we can. We know that you can do liposuction the traditional way, and that can get rid of some of those things. But again, the goal in this case is to try to do least amount of trauma to the body as possible. All right, so how does it work? When we say freeze it away, what are we doing?
Well, they've noticed through anecdotal events in the past that cold applied to fatty tissue can cause that fatty tissue to literally atrophy and go away. Now, what they do here is they've studied with science and found that a certain temperature will freeze fat cells and yet completely spare the water-based tissues such as skin, arteries, nerves, muscle. So by applying a specific temperature to the fat area, you'll freeze the fat. A little diagram here shows, here's an area of fat. Here it is being basically frozen or solidified using the device. And then after that, the cells undergo a change, something called programmed cell death or apoptosis. Either way, the body now recognizes these as impaired and brings in their lymphocyte system, the immune system, to clear them away.
Okay, so it comes out, it just exits the body.
Oh, yeah, over the next few weeks to months, the fat cells are selectively gobbled up by your macrophages because they were literally damaged during the freezing process, and they're now recognized as impaired. Here's a typical example of what happens to a fat cell. It undergoes the freezing process where it's now is damaged, and the program cell destruction
comes along.
And the little, exactly, this is your little macrophage, comes in, eats it all up, brings it back to your recycling center, otherwise known as the liver, where it's going to reprocess everything. Then you become the fat cells can literally be metabolically consumed.
So basically, you can go in and have it done, and over a series of weeks, you'll see a reduction.
And
all right, and
really
Dana,
cool.
you have this. Here's how it works right here.
This is the head that we use to place over the area of fat. For example, like you can see this, and the cooling plates are inside the head. So we take this and we put it on the area of fat, and it sucks the fat down, and within a few minutes, it takes it below freezing. It stays at the freezing level for over an hour, and that's what causes the fat cells to explode.
Yeah. Now, Samantha, you've already had it done.
Yes.
What, about a week ago?
Thursday, yes.
Thursday, okay. And how did it feel?
Like you're being squished.
If it's squeezing your fat out, you don't care.
Have you ever played with a vacuum cleaner when you were a child?
No, I have not.
Oh,
no, I have
not.
not.
Then. Suck
Yeah, so that's it. So it pulls that up there.
Pulls it right up.
What type of reduction are we talking about? Is all the fat gone? Some of the fat gone?
Generally, the results indicate about a 30 to 40% of this treated area will be destroyed by the fat cells will be destroyed by the process.
Okay, so you could go back in conceivably if you don't have, if you want more.
If you have a little thicker layer, then you could do repeat treatments.
And is it gone for good?
It's gone for good. That's the beauty of it. This is fat cell elimination.
Yeah.
So remember, we're given a certain number of fat cells. So those fat's never going to come back, not to that area at least. And so, yes, it's permanent fat cell reduction, FDA approved.
Yeah.
It's
some of the more popular places on the body, especially for women, would be the tummy and then the thighs. But can you use this on just about any part of the body?
Just about any part of the body that can be, that you can grasp it with the machine. And so, yeah, love handles, saddlebags, inside of the thighs, bra back area, back of the arm, all of these areas. Yeah.
And where can I get one of these to take home?
We're going to keep an eye on this one.
Exactly. I might rustle you in the parking lot for that. All right. Really neat technology. And again, as I said, we're getting better and better at not disturbing so much of the body to get what it is that we want. The Anti-Age Institute has a special offer. Mention Great Day and receive $100 off Zeltiq treatment for each area you get. The more areas you treat, the more money you can save. If you'd like to see Zeltiq up close, the Leconeys are having an open house this Wednesday. It's from 5 p.m. to 7 p.m. You can see a live Zeltiq demonstration, and you can also ask questions. For more information on Zeltiq at the Institute of Anti-Aging, call 713-807-1000, 713-807-1000, or log on to antiageinstitute.com. They do all kinds of things that address anti-aging and our aesthetics, if you will. So thank you all very much. Thank you. Hi there, Twala. What's your question?
Hi, my question was for you, doctor. I wanted to know what was the age requirement for the procedure, and also was there any side effects after the procedure was done?
With Zeltiq, all right, Dr. Leconey?
Procedure. You know, there's no set age limit for that procedure. It's really more whether you're a candidate based on your body mass index. In other words, whether your height and weight ratios are pretty close. If you're within your, 15–20% of your ideal body weight, and you have problem areas of fat, virtually regardless of your age, it's not age dependent. The side effects, it's a little tender after the treatment. It feels like it's bruised. Sometimes there's even a little kind of bruising appearance there. So when you touch it right afterwards, it's a little tender. That's going to last for a couple of weeks. And as it resolves, that's when you see the fat reduction appear.
Yeah, and just to clarify, this is not a weight loss method. It is more of a contouring.
Right, a contouring. That's what they call it, Coolsculpting.
Yeah. All right, there you go. Adriana?